First of all, we are not doctors, and this is for entertainment purposes only. So only take this as our opinion. I'm going to start off first in the reverse. I'm going to start off with this update, and then we're going to trickle backwards.
Before someone tries to silence him.
This is an important update on the Hantavirus outbreak for May 14th, 2026, which has caused a lot of confusion, anxiety, and fear that this could potentially become the next pandemic. As of now, however, that remains highly unlikely. There has also been a lot of mixed messaging surrounding how this virus spreads, including comments from Harvard professors appearing on mainstream media outlets like CNN and MSNBC discussing the possibility of transmission. According to the earlier outbreak study published in the New England Journal of Medicine, the first documented human-to-human transmission involving this exact strain occurred at a birthday party. At that gathering, which lasted only about 90 minutes, reports suggested that one infected person transmitted the virus to another individual despite having no physical contact. In fact, they reportedly only greeted each other briefly in passing. That certainly does not sound like prolonged close contact. There were also people seated at different tables during the event who later became ill. One man who attended the party eventually died and passed the virus to his wife, who then reportedly infected 10 additional people during his funeral. So I believe we may have been understating how this virus can spread by focusing too heavily on prolonged close or physical contact, when the available evidence suggests transmission may also occur among people who are not in especially close contact, and that it can happen fairly quickly. However, if you carefully review the supplementary tables in the paper, it only states that there was possible transmission between two individuals greeting each other, and we do not actually know how physically close they were at the time. The study also notes that there was little evidence of transmission beyond neighboring tables, separated by more than 6 feet during the party. One of the lead researchers, Dr. Gustavo Palacio, also told Le Monde that this virus does not appear to be as transmissible as many other respiratory viruses. Unfortunately, what makes this hantavirus strain unique is that it does appear capable of human-to-human transmission, which means it should absolutely be taken seriously. As people get older, experience more stress, or maintain irregular sleep schedules, immune function and recovery capacity may gradually decline. Many people notice they become more fatigued, less energetic, or more prone to feeling unwell after seasonal changes or lack of sleep. Because of this, nutritional support aimed at maintaining overall wellness and resilience has become an increasingly common part of daily health routines. I'd recommend looking into XKQNAD, developed by Royal Laboratories in the UK. It may help support daily energy, overall wellness, and the body's natural defenses, especially for people who frequently stay up late, deal with high stress, or often feel run down. Many users report feeling more stable physically and mentally after consistent use, with noticeable improvements in energy and vitality. However, inventory tends to sell out quickly whenever it gets recommended. You can easily find it by searching XKQNAD on Amazon. And
so I'm going to say, so it's 2 parts I'm going to say.
Okay.
2 parts I'm going to say on that. What I believe he's saying is absolutely true. I don't know if the second half about the XRQ is a company he's affiliated with, or it's just he's just trying to give you an update because it sounds like a little salesy on the end, but I don't know, a little promotional, maybe so. But the first part of what he's saying, that's the dangerous part. And we're going to roll it on back to what's being said of the people who I feel aren't being truthful.
And initially they first said that the people who contracted it first were Dutch and went to a field where they were observing birds in a land. So this is completely opposite.
Exactly. And the spread is going quick. How can something, let's go, and I'm going to address that again. So this was the people of who? This is why I believe that Trump doesn't trust these people, because they say whatever. And by the time they give you the truth, it's already too late.
Yeah, they want to keep the stress down.
Give us the truth. Let us decide on our stress. This was yesterday. Well, this is what I have yesterday. He may have said this a couple of days before, but I'm going to play this.
The incubation period of the virus, which can be up to 6 weeks, it's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low. It also shows why the international health regulations exist and how they work. WHO is working with multiple governments and partners on the response under those regulations. Our priorities are to ensure the affected patients receive care, that the remaining passengers on the ship are kept safe and treated with dignity, and to prevent any further
So it
spread
goes
of
back
the
to
virus.
when they're on the ship.
Given the incubation period of the virus, which can be up to 6 weeks, it's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low. It also shows why the international health regulations exist and how they work. WHO is working with multiple governments and partners on the response under those regulations. Our priorities are to ensure the affected patients receive care, that the remaining passengers on the ship are kept safe and treated with dignity, and to prevent any further spread of the virus.
Okay, and I'm going to keep going. So they start saying, shortly after that, the CDC start reporting, hey, there's no cases of the antivirus. So we're like, there's no cases. So you guys are good to go. There's no cases to worry about. You have no concerns. So it's like, because they're saying that version is the version that jumps person to person.
Across all these groups, our focus is to ensure appropriate health monitoring and quick self-isolation and access to care if they get sick. Before I talk about the monitoring guidance, I also want to clarify some things on Andes virus testing. First, CDC does not recommend testing people for Andes virus who have not experienced symptoms.
Boom. So you're saying that there's no cases, but you don't test for it unless symptoms are of it. That's cap. How do you know? Y'all don't have a clue. You don't have a clue. What's the truth?
This is whack.
So the hantavirus is running around. Oh yeah. Oh, it don't look like symptoms. So we're not going to test for that. So it's no cases. I don't believe that.
And then it takes 2 weeks for them to say to start to even become symptomatic.
Correct. And so it is transmissible. Go back what the first doctor said. He said that these people were sitting at the cross from the table. They weren't, or passing, and they still got sick, and 10 people got hit with it.
And her husband died. That's horrible.
And funny, WHO has not reported anything since the 13th. So today it's the 16th. CDC hadn't reported anything at the same time. They had stopped reporting things on the 12th. WHO stopped reporting stuff on the 13th, and now just got an update saying, oh, well, we don't test for it unless we see it. So how can you claim there's no cases for something you don't test for?
Insane.
Exactly. And then I'm starting to see stuff like this. A case pop up in New York, but
High school.
in a high school. How did they get it? Then you go back to, I saw this a couple of days ago, 41 people being monitored for it.
Oh my
Americans in a
gosh.
dozen states being monitored for hantavirus, including 16 people who the CDC says were not on the cruise where the outbreak began, but may have been exposed during travel on flights.
See?
In Kansas, 3 of those transferred to the hospital for observation after officials say they had high-risk exposure to an infected person who was not on the ship while abroad. Now the medical director of Nebraska's biocontainment unit telling ABC News she doesn't believe that Dr. Stephen Kornfeld, the lone American known to test positive for hantavirus, ever had the virus, despite testing positive with a sample taken while on the cruise ship.
The test could have been a false positive?
That's what I suspect, was that initial test was false positive.
Dr. Kornfeld, whose most recent test came back
What'd I say?
negative, was the acting doctor on the cruise ship
Lies.
when he came down with flu-like symptoms. He's now been moved from biocontainment into the quarantine unit, where he is weighing whether to quarantine the recommended 42 days in the unit or finish from home in Bend, Oregon.
I think everybody in this unit is sort of having that discussion with their own health system and with their family. Some will probably stay here the entire time. Some may ultimately go home.
The doctor reiterated
Spread it
if
on.
he were to go home, it would not be on a commercial aircraft.
Emotionally, I feel
So I don't need to hear more. But
Okay.
I will say this.
So why send them home then? If you're not going to send them on a commercial aircraft,
Mm-hmm.
which says that it's still we finished? can take these off because I don't like talking with these on. Which means they're trying to reduce susceptibility of someone else being, it passing to someone else. They stay there and just stay there for the full 42 days.
Babe, I believe that there are the people that they have contained, and now it's among the masses. I believe this is among the masses, and I believe that we are. So I've been listening to, like you said, man, I listen to God, and also I listen to prophetic voice that have said truth that match up. And I believe this is way too early. I think it's hitting way too early. And I think that the full effect of this is going to take about a year and a half when all this stuff really goes overboard. But to see it early now gives you some prevention. So what I'm going to say is, again, we are not medical advisors. This is entertainment purposes only. Get your immunity up. Don't listen to the powers that be. Get your health up, because that's the only protection that you really have. There are medical things out here that people are mentioning. You can look it up. That might be worth taking consideration when you take X and other places.
That's it. Ain't really much else to say. Don't be fooled. Don't allow yourself to act like nothing is going on. Pay attention and be smart.